Hello friends, today we are going to discuss regarding investigations in a patient with hypertension. So, investigations are done in a patient with hypertension in order to number 1, confirm the diagnosis of hypertension. Number 2, to identify the secondary causes of hypertension. Number 3, to assess end organ damage in a patient with hypertension. Number 4, to assess cardiovascular risk. Number 5, to guide treatment decision. Hypertension is not just high blood pressure, it is a multi-system disease. Now, we will go through the baseline mandatory investigation which should be done in every patient with hypertension. These investigations may include number 1, urine RM. So, in urine RM, we basically detect protein and RBC which may indicate early kidney damage. Number 2, serum creatinine and GFR which may indicate chronic kidney disease. Number 3, serum electrolyte. So there may be hypokalemia or sodium excess in a patient with primary hyperaldosteronism. Then ECG. ECG may reveal ischemia or left ventricular hypertrophy, and it could be a sign of cardiac damage. Then echocardiography. Echocardiography may reveal left ventricular hypertrophy or diastolic dysfunction and even ejection fraction. Then USG. USG is done to assess kidney size, and renal Doppler to assess if the patient has renal artery stenosis or not. Then chest X-ray. So chest X-ray may indicate cardiomegaly or signs of pulmonary congestion, which may be a feature of long-standing hypertension in such patients. Then there are investigations which are done to assess target and organ damage. So if there is involvement of heart, then ECG or echocardiography. If there is involvement of kidneys, then urine albumin creat ratio, serum creatinine, and USG KUB. If there is involvement of brain, then CT scan brain to rule out stroke, ischemic or hemorrhagic stroke. And if there is involvement of eyes, then fundoscopy to assess hypertensive retinopathy. Now, we have to assess for secondary causes of hypertension. So, investigations are done if a patient is suspected to have secondary cause hypertension. So, there are some certain special investigations. So, these investigations are done usually in individuals who are less than 30 years of age, young, or if they have resistant hypertension, sudden onset of hypertension, hypokalemia, or episodic symptoms. So, if the renal cause is suspected, then renal Doppler to assess renal artery stenosis or USG abdomen to look for contracted kidneys. Number 2, endocrine causes. So if we are suspecting primary hyperaldosteronism, then aldosterone-renin ratio. Number 2, if we are suspecting Cushing's, then serum cortisol and dexamethasone suppression test. And if we are suspecting pheochromocytoma, then plasma metanephrine should be checked, and thyroid function test if a thyroid disorder is suspected. Then finally, if we suspect it to be a sleep-related disturbance, then polysomnography to assess obstructive sleep apnea. And at last, ambulatory blood pressure monitoring. So ambulatory blood pressure monitoring should be done in patients who are suspected to have white coat hypertension or masked hypertension, or to assess dipping pattern in a patient with hypertension. Thank you.